Alright, y'all. Hello again. So let's look at this next point, and this is what we look as a doctor-patient understanding. So we're going to begin with this first point, looking at how a patient's general understanding of disease and illness looks like through the disease-illness concept. So essentially what we're looking at here is pretty much establishing the building blocks between a doctor-patient conversation in terms of what a patient understands and knows about things like disease and illness. And as well, for the doctor to convey what these things mean to the patient through a perspective of what their culture and societal backgrounds could potentially look like. So going back to where we began there, to give the patient an understanding of what their disease or illness looks like, so what the patient might be lacking in terms of information or perspective as to what the disease is, first and foremost through an outside perspective, through a cultural or societal perspective, and then going into what an internal perspective would look like for the patient as well, in terms of how the patient might be considering what the illness even means, or what some symptoms could potentially mean or look like as well. And lastly, with this as well, is to give the patient a perspective as to what all this means through a diverse view and once again a societal understanding. So it really is trying to establish the context and the building blocks here to what an illness looks like through perspectives of culture and society, and then through an outside understanding of how it is applied to them through once again a cultural and societal understanding. And I say cultural and societal understanding because this is not going to be a one-size-fits-all sort of thing, because it's going to be different person to person. Each person is going to be looking at this in a different perspective, and is all going to have a different understanding as to what things are. So to establish a baseline with the patient to what these things look like or what they are is really what's important here for establishing a meaningful and very impactful dialogue through the patient illness and disease concept. So keeping that in mind in terms of the patient is understanding these things and how the doctor is explaining these things to a patient that's relevant to them at the end of the day.